myself, Dr. Sivaraman, MD General Medicine. I am a consultant physician and diabetologist from Pondicherry. In today's session, we are going to discuss about chronic kidney disease and its association with fetal edema. First, let us see what is chronic kidney disease. It is a continuing and permanent damage to the kidneys, which is medically termed as chronic kidney disease or chronic renal failure. The kidneys are vital organs in the human body for day-to-day function, and it performs variety of purposes, including maintaining the body's mineral and electrolyte balance, assisting in production of red blood cells and vitamin D3, acid-base balance, and excreting water-soluble waste. Kidneys that have been damaged lose their capacity to execute these functions. So, kidney disease, which is termed as chronic kidney disease, is divided into 5 stages. The first stage where the kidney function is more than 90%, and second stage where the kidney function is 60 to 90%, and the third stage is 30 to 59%, and the fourth stage is 15 to 29%, and the stage 5 is going to be less than 50%, which we call it as end stage renal disease. So whenever your kidney function, which is measured by a entity called GFR, glomerular filtration rate, and it is less than 15%, you are going to label the kidney disease as end stage renal disease. Okay, so since kidneys lost their functions, how we are going to know whether the kidney is losing its function? We are going to have few signs and symptoms which are going to let us know that patient is having chronic kidney disease. Okay, the first of it is fetal edema. The second is going to be few patients are going to experience nausea and vomiting, lack of appetite, sleep issues will be there, and patients will have a decrease in the urine output and diminished mental sharpness in the form of patient will have an altered sensorium or altered speech. Muscle cramps can be there. Few patients experience very high blood pressure, which is not controllable with medications, and many patients develop having shortness of breath. So as we looked at the signs of CKD, the major symptom patients which makes the patient to come to us is going to be the pedal edema. So what is pedal edema? Pedal edema is the swelling of feet and ankles caused by abnormal buildup of fluid in the ankles, the foot, and the lower legs. It can extend up to the level of knee joint. Okay, edema of the foot is caused by two different mechanisms, which can occur separately or it can occur together. Okay, so what are the mechanisms of pedal edema? It is going to be heavy loss of protein in the urine or because of the impairment of the kidney function as a whole. These two mechanisms can cause pedal edema. Okay, so what is this loss of protein in the urine called as? The patient is going to experience a condition called nephrotic syndrome. Okay, nephrotic syndrome is defined as loss of protein in the urine. Along with the patient will start experiencing edema. A decrease in the protein called albumin, which is usually not excreted in urine. Whenever a patient develops chronic kidney disease, the albumin protein is going to get excreted in the urine. When the albumin is getting excreted, the patient will start developing fetal edema due to a mechanism called decrease in oncotic pressure or protein mediated pressure. Okay, and the kidneys then detect a decrease in the blood volume and they try to retain the salt in the body. As a result, the fluid will collect in the tissues, resulting in edema. Fetal edema can also occur when someone stands or sit in same posture for an extended duration of time. The symptoms of fetal edema include swelling of or puffiness of the tissues underneath the skin that is stretched, shiny, and skin that retains a dimple or pit after being you're pressing that place for a few seconds to minutes. Okay, so let us look at ways to treat this fetal edema, which is secondary to chronic kidney disease. The treatment includes treating the underlying inciting cause, whatever caused that kidney disease, try to solve that problem first, and then you try to lower the salt intake. And in many cases, you use a drug which is called a diuretic. Okay, a lot of times in common man term, they which is called as a diuretic, which is few people tell Lasix. Okay, it's a tablet, and if you give this tablet, the patient will be eliminating excess of fluid. It may also be beneficial to use compression stockings and keep the patient's legs elevated at a higher up position. Okay, so how to reduce salt intake? Edema can be increased by sodium, which is a common content of the table salt which you use for cooking purpose, and it is also there in the processed foods or the tinned foods, which is available in the supermarkets. So reduce the salt consumption, and this can diminish or minimize the edema. And whenever the patient is together with a drug like diuretic, it is going to have an enhanced effect. Use of diuretics. What is how you are going to use diuretics? Diuretics are drugs that are going to induce the kidney to eliminate excess water and salt, hence thereby reducing the edema. Because of eliminating too much of fluid, can drop the blood pressure of the person. Few patients after starting diuretic might experience some kind of dizziness or lightheadedness, and a few patients even faint, and their blood pressure might not be recordable certain times. So you should be very cautious, and you should be very cautious in the dose which you use for in a patient with chronic kidney disease. After using a diuretic, you may need to empty your bladder regularly. Okay, so the patient will have frequency of passing urine. Okay, then however, even though I'm telling about the adverse effects of diuretic, many patients will experience few adverse effects very rarely or not so frequently. Then compression stockings. Compression stockings can be used to prevent and also to treat fetal edema. Although good measuring and fitting stockings can limit the risk of discomfort, certain stockings can cause skin irritation. Okay, so you should be very careful when you use compression stockings. Effective compression stockings exert the most pressure at the ankle and progressively decrease the pressure of the leg. So it will be like having a like a compression effect. Is going to squeeze the fluid, and it is going to push the fluid out of the lower limb area. Then body positioning. Elevate your legs above the uh, heart level. So what happens when you elevate the limbs? What is going to happen? There is going to be a gravity mediated displacement of the fluid towards the heart. Okay, and you try to maintain this for a period of around 30 minutes, 3 to 4 times a day. Okay, so this is going to have an additive effect in many patients. Lastly, it is not always possible to prevent CKD. Controlling diseases like high blood pressure and diabetes, on other hand, can benefit. If you are at a high risk of CKD, you should get regular testing. Early detection can halt or slow the progression of the disease. Limiting the salt intake, choosing foods with low potassium, and having physical activity can help in reducing the fetal edema caused secondary to chronic kidney disease. So, hopefully, and uh, uh, willingly, we people as doctors and even as patients should advise our colleagues and our friends and our patients to follow certain lifestyle measures which are going to reduce fetal edema, thereby decreasing the effect of fluid retention and helping them to have a better life. Thank you all.